Well, welcome. It's time for Wellness Central, and today we're going to turn our focus to the global health landscape, specifically the Human Metapneumovirus, which has triggered concerns worldwide. Now, while HMPV is not new, its resurgence has led to a heightened global surveillance due to the risks, and particularly for children and also every individual, with immunocompromised individuals specifically. Now, the virus is primarily spread through respiratory droplets and close contact with people, similar to flu, and also symptoms can range from mild colds to severe respiratory distress. Here in Nigeria, the Nigerian Center for Disease Control has assured the public that there are no confirmed cases of HMPV in the country at the moment. The NCDC has commenced testing and monitoring efforts as a precautionary measure. Officials have also emphasized the importance of preventive practices such as regular hand washing, wearing of face masks in crowded spaces, especially in seeking early medical attention when respiratory symptoms occur. Now, while Nigerians' current risk is categorized as moderate, there is growing concern about Africa's exposure to global outbreaks due to gaps in healthcare infrastructure and also international travel connections.
And so joining us to shed more light on this discussion, we're joined by Dr. Maria Moshudi. She is a public health physician, and she joins us here to give a bit of insight into this conversation. Dr. Moshudi, many thanks for joining us. I had an issue saying the name Human Metapneumovirus. There we go. Exactly. Pneumovirus. Another respiratory disease.
Yeah.
Just coming off the heels of a pandemic from 2020 that had the world at its knees, and even public health sectors, even the best of the world countries with public health facilities grapple with this. Yeah. Should we be worried?
Yes. As a country, we are already putting in place what we need to do, and so yes, we should be at alert. So not necessarily worried, but at alert. We should, as a country, the NCDC has already done an assessment, a risk assessment, and it's shown that we are moderate as at Monday, and then this is a continuous process. And so as a country, we'll just keep putting all necessary things in place to ensure that once we get the red alert that we have a case, we'll be able to move.
We came off of the Ebola virus instance, and right off the back of the coronavirus instance, the authorities here in Nigeria, when it comes to health, actually handled these cases, well, moderately well, very well in the case of the Ebola virus. And I mean, nobody saw the coronavirus, or you can't say that you passed it or you failed it, but we're here now. So based on that, how much trust should I have in the authorities' declaration that we are at moderate risk and we should have no worries at all?
Okay, so you see, really the authorities put in a lot, particularly for the coronavirus, for the COVID virus. It was a lot, and Nigeria as a country did very beautifully compared to other countries. Yes, so as a country, the Nigeria Center for Disease Control, we have structures in place already. And so we're just, at the onset of any epidemic, pandemic, or outbreak, all the structures are just reactivated. So for instance, in Nigeria, we have the influenza centers that are in 6 geopolitical zones, and they have been activated. During the COVID, yes, these centers were able to carry out the COVID testing. And so there are already preparations put in place for those centers to be able to test for HMPV, should in case we have any case. And then also not just that, very importantly for us as a country is our point of entry. Nigeria, Lagos, for instance, is beehive of activities. Can imagine the number of people we had in country in December coming in and out, and people are still tripping in and out of the country. And so the point of entries are already being manned. The port health officials have been trained as expected in presence of any pandemic, and the necessary measures have been put in place. There is an ongoing, continuous, regular assessment. The officials have been trained. Quarantine stations are isolated, and also the health declaration form is currently in use. Once you go out of country, you're coming back, you need to fill that form, and then this gives an insight. So the form, their soft copy, their hard copy. So once they're filled, you're able to look and say, oh, this person needs to be put under quarantine, and then person gets quarantined. Someone that has to be isolated is also isolated. So all those necessary measures are put in place. That's for the quarantine, and then should in case someone comes down with the HMPV, There are centers that are already, we have infectious disease centers where people are managed. And then currently, HMPV doesn't have any vaccine. So it's mainly supportive treatment, hydration, rest, and then treat as symptoms, occur as case may be. So
Right.
the country is, I think doing a good
Judith,
job.
remind me about those forms she talked about from before. I have something to ask about them, but go ahead.
I'll do that if my brain allows me. Let's talk about the primary modes of transmission for HPWV. Sorry, HMPV. I don't know what W is saying there.
That's German if you're mistaking your V's for W's.
Yeah, there we go. I mean, but what's interesting about it bears almost same similarities with respiratory illnesses like COVID-19. That is it. I know this is a speculative, conspiratorial question, but bear with me.
All right.
Is this a hybrid or this is an offshoot of COVID-19? Is it?
Okay, so the thing is, HMPV has always been there.
Yes,
It's been.
I don't know.
It was first. So it was first identified in 2001 in Netherlands, not even China, among Dutch children. However, it has always been there since decades, several decades. However, what is bringing the concern now is because we are having a higher number of cases than normal. And you can see that it has a particular trend. It occurs in the colder seasons, winter towards spring or Amazon for us here in Nigeria. So we can see that why China has come out to say this is what we're having is because they usually have HMPV cases, but this is not above normal.
Okay.
This looks like an outbreak, becoming like an epidemic, and then can become a pandemic if not taken care of. So that's why that alert, it's important.
I'm sorry.
It's fine.
You got my facial expression. I was wondering how deadly it is.
Okay, so it's a respiratory infection. And like you said, symptoms, you can have cough, fever, you can have nasal congestions, wheezing, as case may be. However, people can have complications like pneumonia, bronchitis. And how deadly it is, to answer that question, is dependent on individual. Because studies have found that some people are more susceptible than others. Children, older adults, people with weakened immune systems. And so people that have comorbidities, they have additional underlying health conditions, will have poor outcomes compared to people that have a very stable premorbidity.
But you did mention that there's no vaccine or cure for it. So you could get it and still get better.
Yes, you could get it and still get better supportive treatment, basically.
But there's the risk of it ending up in mortality.
Yes.
Huh? Well, wait.
Oh, that brought you back? Welcome back to this.
I thought we were just talking about cold now.
Yeah, no, but that's the thing, because that's what people have. It's just it's just like a cold.
Yeah, I thought it was so it now begs to ask the question of when should we, where is the line between mild to now severe, go to the hospital?
Okay, so I think that also boils down to our health-seeking behavior. In our environment, we have very poor health-seeking behavior. You have a cold, some people use, get to the pharmacy, get over-the-counter drugs, and just take it up. They don't even bother to present at the health facility. So it's important for us as individuals to improve our health-seeking behavior. You come down with a cold, you might just think it's a cold. But remember, someone that is asthmatic might feel, oh, maybe I'm wheezing or something else. It's a bit more than that. So it's better that we present at the health facility on time, particularly now that we're having HMPV. And everybody, it's not just catarrh, it's not just cough, So it's important that we present early at the healthcare facility. And then, yes, you see a healthcare practitioner and the person says, oh, don't worry, it's mild cold. Or no, there's something I can listen to in your chest that is a bit above normal.
Are there peculiar symptoms that are different from that of the common cold or flu?
No, so it's respiratory illness. So you can even see the symptoms are almost the same, just like COVID. You can have cough, fever, but you can see this cough is not resolving, this fever is not resolving. The healthcare practitioner is able to tell you that no, this cough is beyond normal.
This wheezing you're eating is just too tedious for your chest.
Can I use the final few minutes to ask that question regarding the forms?
Yeah.
Now, here's the thing, and because you brought back the COVID instance, and this is why I'm asking this question, regarding those forms, I was outside the country, and when I came back in, I was presented with these forms. But I was also told by the gentleman, not so gentle, who offered me the form, he said, are you going out of the country anytime soon? I said, no. He said, okay, just hand me some money and you don't need to fill the form. So that broke my trust in the system, because that means that I could still bring in this virus and not be attended or not be noted. And I could go about spreading it. The facilities, the structure, the people, the personnel. If we have this kind of an instance coming back, how prepared, I go back to our very first question now, are we for that kind of an instance, noting the failures from the last instance?
Okay, so, well, I think I want to start with failures from last incident, but I'll pick that scenario that you gave at the airport. I think I was out of country like 2 months ago, and well, you know, because there's a link, so most people are just told to put on a link. But you see, even in any system, we just have to try and see about the negatives, then put it that way, because ideally that wasn't supposed to happen.
No, it wasn't.
Because even on in the L declaration form, you have several things that there in the last country you visited, where you plan to go next, you know, and then symptoms that you could have. So it's nothing, nobody is going to punish you for filling that form. So I don't see any reason why someone should say, no, you don't have to fill the form.
You remember you had to come up with a certificate from the other country noting that you you're not positive. They would take money from you and just disregard the certificate. If you don't have it, it's okay, just give me something under the table.
That definitely is not right.
Well, go ahead, because you're about to finish.
Yeah, that definitely is not right. But however, with the HMPV, now, so of course, I know that all hands are on deck at the port of entries. And remember that we also have several port of entries in quotes, porous port of entries.
Yeah, porous.
Exactly.
Yeah, people go in and out on a daily basis, you understand. However, I know that officials are working day and night to ensure that all these port of entries are properly manned. And then even when you go through the land borders, you also have to fill the forms. Yes, when you go through the land, I remember there was one time I just practically walked across the border between Badegry and Semen border. But you still have to fill the form.
Right.
Yes. So
yeah, let's quickly center the immunocompromised individuals and the elderly. And worse is the elderly that are already immunocompromised. How can they then protect themselves, you know, especially at this time?
And then also, particularly, also children, you forgot to mention.
Unfortunately, I don't have children, forgive me. Children. I mean, I keep forgetting this one.
Children, yes. So it's important that we take necessary precautionary measures. The first is this sensitization awareness. Everybody needs to know there is HMPV in the world, not in the country now, in the world. And so we need to take measures. We need to increase our sensitization, tell people. And then after that, we need to improve on our hygiene. First things first. So hand hygiene. Remember during COVID, everybody was we're washing our hands as if our life depended on it, you understand? So we need to improve our hand washing, and particularly for children. Remember, they pick things from the floor, just pick things, and then put in their mouth and they share with their friends. So we need to improve hand washing.
I'm sorry.
We need to improve hand washing for the children, and then also ensure that they imbibe with those habits. And then it's also important that aside hand washing, cough. We need to improve our cough ethics. So if you know you're coughing, please don't go to crowded places, don't go to public places. Stay away, and then you know, from the crowd. And then if you're coughing, please ensure that you cough into a tissue paper that you discard appropriately, or you cough into the your bent elbow, so that you don't disperse the particles into the air, and then someone else doesn't take it up. And then also for the elderly, for the people that you have mentioned, they should also ensure that they wear icy materials. You can use the face masks, you know, if they're having a cold or something. They can try to improve their immune system by taking lots of fruits and vegetables, as the case may be.
Right. Listen, this is a clown call to the mother, all right, if you watch, because I know she's...
School owners.
Oh, school owners as well, there we go. But when I say the mother, she knows herself. She's elderly and also immunocompromised, and she's telling me she's going for mass tomorrow. If I catch you, I'm ready for a driver, I cannot come and get you. Better stay in your house. You can attend mass, you know, online.
You've given us such great information about what to look out for at this instance, and we want to thank the authorities for also making sure that everybody's well informed. Thank you very much for being a part of the show. The reason why I laughed while we were talking about children and them putting...
I had to laugh because my niece...
You just be at work and then they just call you, sorry, your daughter just swallowed padlock.
Oh my God! Oh, that's coin. It's a coin.
And then please, parents should ensure that if they have sick children, please keep them at home. Don't let them go to school so they don't infect their colleagues.
Yeah, there we go.